Ladies and gentlemen, esteemed guests and distinguished panelists, good afternoon, and welcome to Egypt Healthcare Authority panel discussion with the title Global Health Tourism Opportunities, Trends, and Innovation. It's with great pleasure that I extend a warm welcome to each and every one of you gathered here today. I am Asma Salman, General Director of Marketing and Business Development of Egypt Healthcare Authority, and I'm honored to serve as a moderator for this enlightening panel discussion with my background in business development, global marketing, and healthcare. Before we commence our enlightening panel discussion, we have the privilege of starting our proceeding with a captivating video presentation. This video serves as poignant introduction to the medical tourism we will be exploring throughout our discussion. Prides itself on delivering world-class medical care of the highest standards. It's Sharm el-Sheikh International Hospital, one of Egypt Healthcare Authority's state-of-the-art healthcare facilities. Without further ado, let's now turn our attention to the video presentation. And now, allow me to introduce the esteemed chairman of our panel, Dr. Ahmed El-Subki, as the chairman of Egypt Healthcare Authority and general supervisor of Haya Karima. Dr. Subki brings a wealth of experience and expertise to our discussion today. His visionary leadership and dedication to advancing healthcare have been instrumental in shaping the landscape of global medical tourism. We are truly honored to have Dr. Subki join us as our keynote speaker, and I have no doubt that the insight will set the stage for enlightenment and thought-provoking discussion.
Thank you so much. Thank you, Asma. And first of all, I'd like to welcome all the attendees, our esteemed colleagues, and also our esteemed panelists. Thank you so much for coming. Thank you for sharing us this moment. And as a chairman of Egypt Healthcare Authority, I have the honor to welcome you all in this very prestigious panel. Now, we will have the panel of Egypt Healthcare Authority focusing on the global health tourism from a lot of aspects, opportunities, trends, and innovations. Today, we are very glad to have such eminent leaders in healthcare tourism representing Arab region, Europe and Africa to explore more and more dynamic landscape and the global health tourism solutions and its potentialities and impact on the future of healthcare delivery all over the world, not only in Egypt or in our region. Please allow me to welcome our esteemed panelists, starting with Dr. Alice Yamin Bouez. Thank you so much for coming. Dr. Alice, she's an exceptional leader in healthcare in the Arab region. She is the CEO of Arab Hospital Federation, which is playing a role in connecting and improving healthcare services across the Arab region. They also support collaboration for developing sustainable healthcare facilities. بشكر حضرتك شكرا جزيلا وممتن جدا لوجود حضرتك في البانل. And I will never forget طبعا to welcome His Excellency Dr. Fadi Alama. Thank you so much, the Chairman of Arab Hospital Federation. Thank you so much for coming. For sure, Dr. Hisham Al-Fadil, TMUS Regional Director for Jordan and KSA, he is committed to driving excellence in healthcare accreditation and patient safety. And no one can deny the role of TMUS International as leading the accreditation of the organization working in healthcare tourism, focusing on the quality and patient safety of medical services. And now, my friend, Dr. Magdi Fay, Riyadh, thank you so much for coming, Dr. Magdi. Dr. Magdi is the CEO of Eco Medical in United Arab Emirates, and at the same time, he is health advisor to His Highness Sheikh Mohammed bin Khalifa, and representing more than 20 international companies in healthcare sector. ممتن جدا لوجود حضرتك معانا وان حضرتك شخصيه مصريه ولكن بتقود قطاع الاستثمار في دوله شقيقه في المجال الصحي دوله الامارات العربيه المتحده. Thank you so much for coming. Ms. Serena Krasko, thank you so much for coming, Ms. Serena. Ms. Serena is chairman and founder of Voyage Global Solution. Voyage Global Solution is the major player in medical tourism industry in Uganda and also in some African countries, with a network of over 25,000 providers all over the world, including hospitals and clinics. Thank you so much for sharing your knowledge and experience in this panel. Thank you so much, Ms. Serena. Dr. Lee Oshia, I'm pronouncing it well, Oshia. Thank you so much, Dr. Lee, for coming. Dr. Lee is Network Director at AQA Assistant Group in England, and they provide travel assistance solution and support medical travelers seeking treatment abroad. Thank you so much for coming from England to share us this moment in Egypt. And finally, Dr. Ahmed Munir. Dr. Ahmed Munir, thank you so much, my friend, to come from, I know that you are spending your time in the airplane all time. Thank you so much for coming. Dr. Ahmed is the founder and the chairman of LGA Group. And actually, they are exceptional and committed for healthcare innovation and have set of benchmarks in this industry. And under the leadership of Dr. Ahmed, the future of LGA as assistant group has emerged as leader in the medical assistant industry in GCC region. Thank you so much, Dr. Ahmed, for coming. And I will never forget also our dear guests from International SOS, our experts from International SOS, Dr. Sebastian, the CEO of the Middle East of International SOS, and also Dr. Richard. Thank you so much for coming and sharing us these moments. And finally, I would like to express my appreciation and my gratitude to the project manager of the medical tourism at Egypt Healthcare Authority, Dr. ريهام سلامة. أنا مش عارف ريهام موجودة ولا لأ، بس هي أكيد مش موجودة عشان هي بتشتغل طول الوقت. يعني حقيقي يعني هتكلم في الجزء ده بالعربي. يعني ريهام سلامة من الشخصيات الجميلة والشخصيات اللي بتعمل بتفاني من غير ما بحس بيها في الحقيقة، وهي يعني هي وفريقها ومعاها طبعا دكتورة أسماء. احنا كلنا بنشتغل مع بعض يعني all for one for all. فيعني انا عارف انها ما خدتش حظها من الابريشيشن، وانا غالبا يعني في وسط الشغل ما بدهمش دايما غير تعليمات وتوجيهات، فكانت فرصه كويسه انها تسمع كلمه شكر يعني، بس تقريبا هي مالهاش حظ انها تسمع كلمه الشكر. بشكر طبعا دكتور ريهام سلامة، بشكر دكتور أسماء، بشكر دكتور أبو المجد، بشكر دكتور فتحي شمس الدين، بشكر طبعا القيادات كلهم من هيئة الرعاية. My colleague دكتور أمير التلواني CEO, and I will never forget for sure my brother, Dr. Hani Rashid, the Vice of the Chairman of Egypt Healthcare Authority. Thank you so much, and we are waiting for discussions. We are waiting for the ideas, and I think this will be one of the milestones of this conference, to have such panelists to give us the solutions and give us the knowledge to improve the healthcare tourism in Egypt and in the region and also all over the world. Thank you so much again.
دكتور أليس، مرحبا بيكي في مصر بلدك الثانية. دكتور أليس، if you don't mind احنا ممكن نسأل السؤال بالعربي لحضرتك؟
أكيد.
أول سؤال in regards Arab Health Hospital Federation، ما الدور الذي يمكن لاتحاد المستشفيات العربية أن يلعبه في تعزيز التعاون عبر المنطقة لتعزيز مصر، جمهورية مصر العربية كمركز للسياحة العلاجية؟
أنا أول شيء بدي وجه الشكر أكيد لجمهورية مصر العربية، بس بدي وجه شكر خاص لمعالي الدكتور أحمد السبكي. دكتور أحمد، يعني أنت خامة من خامات الوطن العربي يلي فعلا عم بيعملوا مجهود فظيع لنتقدم بصحة تكون هيك مميزة ومعتبرة. فألف شكر على دعوتكم لنا، وثانك يو على وجودنا بهالمنصة هيدي. يعني ما عيد مخبى دكتورة أسماء إنه اتحاد المستشفيات العربية اليوم كتير بيعول على دور مصر بموضوع إذا بدنا نقول تقدم الصحة بالوطن العربي. مصر فعلا عطت أمثلة رائعة بالسنوات الماضية. أنا ما بدي أرجع بالتاريخ وأقول إنه مصر تاريخها حافل بموضوع الصحة، بس بخلال السنين الماضية شفنا مثال فظيع للتحول بقطاع الرعاية الصحية، ويمكن هيدي أمثلة بنعطيها لكثير من الدول العربية يلي هي بحاجة إنها فعلا تتقدم وإنها تغير من نظامها الصحي. ولما بنقول إنه مصر أعطت هيدا المثال شفناه ملموس. يعني لما منزور مستشفياتها، سواء كان مستشفيات هيئة الرعاية الصحية ولا حتى المستشفيات الخاصة، بنلاقي انه في أرضية فعلا وفي شغل وفي efforts عم بينعمل بشكل مهول. هلا اليوم لما بنقول اتحاد المستشفيات العربية هو وين دوره ليقدر يساعد مصر فعلا انه تحقق سياحة صحية، بالعكس الدور الكبير بيقدر يلعبوا الاتحاد بهيدا الإطار، لأنه يمكن حتى تأخرنا، حتى تأخرت مصر إنها تكون هاب للسياحة الصحية المثالية. اليوم كل اللي نحن عم نتعب عليه، أول شيء خلينا نقول إنه إذا كدول عربية ما تكاملنا وما تعاوننا بين بعضنا البعض منا قادرين نحقق هذا الموضوع. التكامل والتعاون شيء كتير 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 أساسي وكتير مهم، لأنه نحن من البداية عم نشجع مفهوم اسمه السياحة الصحية البينية. قبل ما نبلش نحكي ونقول بدنا نجيب القطاعات العالمية لعنا، خلينا نقول إنه الدول العربية مقسومة قسمين. في عنا قسم أول شيء هو يلي بيقدر يعطي الخدمة، وعنا قسم هو طالب الخدمة. اليوم هيدي هالسياحة الصحية البينية بين الدول العربية قادرة إنها تكون مفيدة، إننا نقدر نخلق بدي. أول شيء نخلق، خلينا نقول مجلس ولا هيئة قيادية للسياحة الصحية العربية مؤلفة من كل الدول العربية بمباركة اتحاد المستشفيات العربية، إنه نقعد ونتحاور مع بعضنا ونشوف كيف الإمكانية إننا نقدر نساعد بعضنا، نتبادل المرضى، نتبادل الخبرات، يعني على هيدا الصعيد. ولا شك انه قادرين ان نساهم ان نسهل التواصل والشراكات بين القطاعات بين بعض البعض، قادرين انه نسهل مشاركه قصص النجاح. السكسس ستوري اليوم نحن بنفتقد كثير انه نعممها، لازم اليوم نعممها. يعني اليوم عندي تجربه ناجحه بمصر، مفروض انا كاتحاد دوري اني اعمم هيدي التجربه، اني خبر عنها تا الناس يصير عندهم ثقه اكثر واكثر بهيدا القطاع، ويجربوا انهم يستفيدوا من الخدمات اللي موجوده فيه. واخر شيء بدي اقول انه نحن قادرين انه نفيد مصر ببرامج التدريب اللي الاتحاد بيعملها. بخطتنا السنويه الاستراتيجيه اللي اطلقناها هيدا العام كثير بتتضمن من البرامج التدريب يلي ممكن انها تعزز من تقديم الخدمه as quality as safety as hospitality بكل هيدا الاطار. هول المواضيع الاربعه اذا فعلا اتحاد المستشفيات العربيه تعاون مع مصر انه يحققون، I think انه بيكون في عنا سياحه صحيه ناجحه عربيه من خلال دعمنا لها.
حضرتك حاطه مصر في ليست التدريب؟
اكيد طبيعي لانه دائما مصر من الدول المتلقيه واللي بتتجاوب بشكل، لانه القدرات اللي موجوده فيها قدرات كبيره وقدرات فظيعه، ودائما هيدي القدرات بتسعى انها تتميز وانها تتقدم وانها تكون من الافضل.
طيب راي حضرتك كيف مصر تقدر بموقعها الجغرافي الاستراتيجي بالإضافة للتراث الثقافي لمصر اللي بتتميز فيه يعني الغنية بالتراث في شتى يعني في أكثر من محافظة، كيف فيها تستفيد من هذا الموقع والتراث بحيث إنها تكون مقصد للمرضى الأجانب والمرضى من الميدل إيست وشمال أفريقيا والعالم؟
اليوم بصراحة بكلمة دكتور سبكي بالجلسة اللي كانت قبل هيدي لفتني شغلة كتير مهمة، وهي يمكن أساس نقطة كتير مهمة. قال نحن عم نشتغل على الريبراندينج. الريبراندينج شغله كتير اساسيه وكتير مهمه، لانه اذا ما في براندنج للمنتج اللي نحن عم نحكي فيه منا قادرين ان نحقق هيدا الشيء. سو اي ثينك انه اول شيء مصر بدها تعمله هو البراندنج. ثاني شيء بدها تعمله يمكن بدها تلحق التجارب يلي غير دول عملوها ودول عربيه. انه انا سالت دكتور امير، كنت قاعده حد منه بالجلسه اللي قبل هيدي، قلت له في هيئه لتنشيط السياحه الصحيه؟ قال لي لا، في هيئه لتنشيط السياحه. هيئه تنشيط السياحه الصحيه بتختلف تماما عن تنشيط السياحه، لانه بتتضمن مكونات هن معنيين بالصحه. هلا صحيح انه اكيد ولا شك السياحه بتكون موجوده من ضمنها شركات وكالات السفر، المستشفيات، القطاع العام، القطاع الخاص، بس هول كلياتهم مفروض انهم يكونوا مجموعين ضمن بلاتفورم واحد يقدر يكون بس اختصاصه السياحه صحيه مش السياحه ككل. سو اي ثينك انه إنشاء هيئة وطنية للسياحة الصحية بمصر كمان هي كومبوننت مفروض إنه يكون أساسي ويكون مهم بالمساعدة لهيدا الموضوع. في كذا فكرة ممكن انه تنطرح، واللي انطرح اليوم بالمؤتمر من كل الافكار بفرجينا انه مصر فعلا هي عم تحكي نفس اللغة مع بعضها. القطاعات كلياتها عم بتجرب انها قدر الامكان انها تتعاون مشان تقدر توصل لهيدا الموضوع. بس في موضوع اساسي وما انتبهت كتير انه نحكيوا فيه، هو موضوع تفعيل الصحة الرقمية. اليوم قديش هيدا المريض ممكن لما بيجي وبياخد العلاج وبيرجع على بيته وبتم المتابعة معه عبر البرودكت تبعية الصحة الرقمية، هيدا يمكن كمان بيعطيه بيكون مرتاح أكتر إنه يحس إنه في مين عم بيتابعه لما عم بيرجع على بيته. كذا نقطة ممكن إنه تقدر تلاقي مصر، بس أنا أكيد إنه مصر رح تلاقي طريقة ورح نشوف قريبا جدا قطاع سياحة صحية ناجح ومهم.
أكيد. شكرا لك دكتور أرس. دكتور هاشم الفضل. I'm sorry. Dr. Hashim Timus, Regional Director of Jordan and KSA, and Chairman of the Timus Advisory Board. Dr. Hashim, our question is, how can Timus accreditation programs contribute to enhancing the quality and safety of healthcare services for health tourists in Egypt?
Thank you very much for the question. First of all, thank you for inviting me, Dr. Shukri, and for this very important conference. Now, when we talk about accreditation, as we heard from the very various sessions today, it emphasizes on quality and safety. Quality and safety is the prime of any service given to patients, whether national or international. International patients, they look always for what's the high quality, what's the high service, in addition to the spectrum of services that's provided. So with Timus standards are two levels. One of them providing excellence in medical tourism, and the other one providing quality, medical quality for the hospital. Excellence in medical tourism, we take the cycle of patients from the time they leave their homes through standards, international standards accredited by ISQA, up to when the patients come to the hospital treated with all various stakeholders, etc., and they go back and they follow up with them. So the emphasis, more or less, more and more on quality and safety and outcome results.
And what about the best practice that hospital and clinics, especially in Egypt, should adopt to meet this international standards you were talking about, and to attract for offshore health tourists from around the world?
Yeah, I can give you best practices from my experience.
Yes, please.
In fact, I have the privilege to accredit and survey hospitals in Thailand, and several hospitals in Thailand. Frankly speaking, they have really best practices. And the question is why, if we benchmark with them, because they emphasize nationally on, they have a medical tourism cluster. And this medical tourism cluster, it has the providers and also the core activities in the center. And on the other side is the service provider. They collaboratively work together for the patient, from the time they leave home till the time they get to the hospital, till the time leave. Based on a report done by, I remember a research by Johns Hopkins about 10 years ago, they said that over 90% of patient satisfaction for international patients comes from non-medical services. Because this is where the medical tourism cluster comes in, and I recommend that such medical tourism cluster, if you can find the Thailand medical tourism cluster, you find it in the internet, and also you find many countries they have that cluster where all stakeholders work together collaboratively to achieve and make steady patients coming regardless of the economic situations, because economy fluctuates. But even with medical tourism, the secret behind it is that even at recession, you have more medical tourism. This is based on a study done by Johns Hopkins, by Deloitte, that the more recession, the more patient medical tourism comes up, because it gets very expensive in their countries, so they have to search for other countries with high quality and safety for other countries.
Thank you, Dr. Hashim. And now Dr. Magdi Faye. Dr. Magdi, CEO of Echo Medical. Dr. Magdi, from your experience in the UAE, UAE, what key factors should Egypt focus on to ensure high standards of medical care and patient satisfaction and health tourism?
Thank you for having me now in the conference, and I think just I'll share a very simple and humble experience in United Arab Emirates. The medical tourism in the United Arab Emirates, it's more to like kind of Department of Health concern. It's not just tourism, but medical tourism, it's industry. But this industry should be governed by the government, by the Department of Health. So there is certain guidelines they are using. We have the committee of the International Patient Committee, which is almost taking care of the evaluation of the capability of the hospitals or health facilities. At the same time, we have kind of statistics of what type of disease we would like to transfer outside the country. So I think it's very important within this committee to work within the government in integration with the other Department of Health in other countries, just to evaluate together what is the needs of other countries. For example, if we have the health authority here, I think it's very important to build kind of protocol with the Department of Health in United Arab Emirates, so they can work together to evaluate the opportunities, the mutual opportunities, which we are working with the health authority right now with this. So accordingly, I think both authorities, they can help each other. At the same time, recently I was discussing the health insurance coverage. If there is any possibility that the health insurance providers could work together. So the health insurance in United Arab Emirates, if it is covering the citizen of certain nationalities, like Egyptian nationalities, so they can get the same service in their country. So instead of having the service only in United Arab Emirates, they might have the coverage in Egypt. So if there is any kind of tourist or nationality, he would like to stay more time in other countries, so the coverage or the eligibility could extend to the other country. So I think the collaboration between the authorities is very important in this case. Yeah.
Actually, you answered my two questions. The next one was, how can Egypt foster this partnership with the healthcare provider in the UAE to enhance its health tourism offerings? So if you want to add any it is, yeah, you answer the two questions. It's very comprehensive. Thank you. And now, Dr. Sarina, the chairman and founder of Voyage Global Solutions. Voyage?
Voyager.
Voyager. It's français.
Voyager, français.
Oh, français. Dr. Sarina, what marketing strategies should Egypt adopt to brand itself? As Dr. Ahmad Subki and Dr. Ellis talked about the rebranding of the healthcare in Egypt. So what marketing strategies should Egypt adopt to brand itself as a top destination for health and wellness tourism?
Thank you. Good afternoon, ladies and gentlemen. First of all, I would like to thank His Excellency and Dr. Ahmad for opening up this platform, for sharing the experiences and views, which is very critical in different cultures, because this is where you're going to be welcoming into Egypt. Coming to the question that was just raised about how the strategies Egypt would be employing into bringing about tourism and medical tourism into Egypt. Egypt as a whole is a holistic destination, and this is where the platform is raised globally, where when you have patients wanting to explore and have the facility of a one-stop shop kind of an experience where they will be able to explore technology, expertise, and a wellness destination all under one umbrella, and Egypt has it all. So in terms of marketing, the e-commerce platform needs to be strengthened, which some of the panel discussions have already captured this. It's very critical in the digital era, and about AI coming into place. Incorporations of technology is very critical. Secondly, I would talk about partnerships. Partnerships with various countries globally around the world. I come from Uganda, which is the pearl of Africa, being connected to Egypt with the source of Nile. And I would say that we have our patients going to Turkey, to UAE, to other destinations. But we have Egypt within the continent itself, so why not have this gateway opened to patients coming here and giving them the explorations of medical wellness into culture, into having exploration about the history. Well, it's not just about having a medical checkup done. I would just want to share my experience, which I had 3 weeks back. I came to Egypt wanting to see what the medical experience of the patient would be. And I visited Luxor, Karnak Hospital, Aswan, the specialized hospital, and vascular arts. It's modern medical platform which is already available in the Africa continent. So we need to bring out the message. We need to bring out the content out to the common people, get them familiar, get them comfortable so that they are able to come to this land and explore the medical platform. Being that into partnerships, you need to make it comfortable. If a patient comes to Egypt, your partnerships with other countries will help them follow up with their treatments, which gives them a comfortable place. This is very critical in terms of a medical experience. So there are these key factors which would enhance medical tourism into Egypt. And it is a strong pillar, which it's already into globalization. I would like to just throw in some light there. Egypt has one of the wonders of the world. Already you have the global tourism inbound coming into Egypt. So if you strengthen, you bring out the message and the content out globally, it's already in there. You just need to bring the ties together, introduce medical cards. The panel discussion just introduced about insurance. Global insurance is a key factor because this is where a customer, when they want to travel, they want to make sure that they are covered in terms of medical insurances. If you have a medical global card which incorporates all these facilities in, you're opening gateways to many more countries around the globe. Thank you.
Thank you. Okay, so how can you support Egypt or Egypt Healthcare Authority to have and attract diversity of nationalities and diverse international segment?
Yeah.
Yeah.
Okay, I got your question.
What do you have? How can you support?
I would come into that with a background of mine. My background comes from aviation with Emirates Airline and Jet Airways, specializing into retail, sales, commercial, and placing Uganda among top of Africa. Needless being said, some of the achievements. And with my medical background, I bring in a lot of experience. So coming back to the question, yes, there is already a plan which is put in place. I've partnered with Lotus Medical in Egypt, along with Master Travel. So I want to make sure that I am engaging with the medical persons in the country to make sure the protocols are followed. It's very essential that the regulations are taken into considerations while partnerships are done. So this is already ongoing, and in terms of diverse cultures, with our network being spread around East Africa and Africa itself, because my company Voyager handles Rugby Africa and World Rugby, so I have all the countries of Africa and around the globe already connected. And this is where I'm trying to build a bridge between the network worldwide, Africa and Egypt. And that's where the logo of Voyager goes, is connecting places, connecting people.
Yeah,
thank you.
Okay, thanks. Great. Thanks, Dr. Serena. And now, Dr. Lee. Yeah. Dr. Lee, an expert of networking of health tourism industry. Yeah, my question is based on your experience in international healthcare networks. What best practice can Egypt adopt to ensure seamless healthcare experiences for international patients?
Thank you very much for Your Excellency inviting me today. This is a real huge honor. I've been in this industry 24 years, and to be on stage with such experts, it's a true honor, so thank you very much. This is a great, insightful question, and I can tell you this is a threefold answer. I would say, from my experience, what I've seen in the industry and opening up other countries is, one of them would be looking at the international tourist visa. Other countries have adopted that, and that has helped the providers, the air ambulance providers, the accreditations to make an informed, good decision of where we're going to send our patients. Secondly, is obviously looking at accredited hospitals and all the regulations. This is paramount. This is one of the main decisions that most international providers are going to look at. And another thing that Egypt should do, is what I've learned over the years is working with the smaller hospitals, working with facilitators in the region, and all of the other parts like medical assistance companies. They all come together, and this will really help facilitate the vision that Egypt's trying to do right now in the international market.
Okay. In regard to the accreditation, the national accreditation is considered as potential or attractive for international patients?
It's still, after all these years, I would say, and everybody here would agree, it's still the number one thing that we're going to look at when we're deciding which patient, where we're going to send them.
Okay.
The accreditation and the regulations is still, for me, and being a network professional with our company, we are going to decide where our patient's going to go based on first pillar, and that is the hospital accredited? And it's just paramount in some of the decisions that we make. I will also tell you from experience that working with such professionals like TIMOS and the air ambulance providers and other assistance companies, still today, we're always going to look at accreditation and regulation.
Okay, I think it's again it's an answer of my next question, that how important the role of accreditation and international healthcare standards in promoting Egypt as a safe and reliable destination for health tourism.
We're going to do our job all the ways. We're going to keep working with the hospitals. We're going to do our research. We're going to speak to all of the international providers and make sure Egypt completes its vision. And I really look forward to being a part of that. And it's just, for me, I'm just so honored to finally be in the MENA regions for so long and help Egypt become internationally recognized. And it's just an honor for us to assist you on your vision to becoming one of the most leading markets in the world in medical health tourism.
Thank you, Dr. Lee. And Dr. Ahmed Munir. It's a founder and chairman of LGA Group. Dr. Ahmed, in your view, what investment opportunities exist in Egypt's health tourism sector, and how can this be capitalized upon?
Thank you so much. عايز بس أبدأ حاجة صغيرة جدا لو تسمحوا لي. عايز أشكر حتى وهو مش موجود أستاذنا ومعلمنا كلنا الأستاذ الدكتور محمد عوض تاج الدين على فخره بالطبيب المصري، وبفتخر إن أنا طبيب مصري وخريج جامعات مصرية. وأستاذ الدكتور محمد عاشور على فخره وإصراره بالطبيب المصري، إن إحنا فعلا مش محتاجين أي خبرات خارجية، وده كان لازم أناونس بيه. والنقطة الثانية، شكر الخاص لصديقي الدكتور أحمد السبكي والدكتور أمير. شكري ده لان هم ناس ما بتنامش، ناس بيقابلوني الساعه 10 بالليل. بجد ناس ادوني امل، وادوا اي حد، اعتقد مش انا شخصيا، ان بجد في حاجه جايه كبيره قوي، وان احنا هنعمل حاجه كبيره قوي. لان احنا ياما سمعنا طبعا، وانا سبت الماركت في مصر من 10 او 11 سنه ورحت الامارات، بس الاول مره بقابل حد بيشتغل اكتر ما بيتكلم، وحاسس ان في امل كبير قوي، ان في حاجه كبيره قوي جايه.
10 بالليل دي امل ليك، بس مش امل لينا احنا اللي بنشتغل في الهيئه مع دكتور احمد.
لا في امل للبلد كلها، لان الدكتور احمد قال لي كلمه، قال لي عايزين نعمل حاجه للبلد. هو مش
فريق
بيقول
الهيئه لو قام دلوقتي وانت بتقول 10 بالليل
الله يعينكم يا رب، الله يعينكم يا رب. بس ده على الاقل في امل ان بجد شايفين حاجه كبيره. وعاوز ادي كومنت لحضرتك صغير قوي، ان انا last 2 weeks I've been around all Europe and UK. I visited I think like 11 country. Wallahi, I visited I think maybe 15 companies. Half of them they mentioned to me about the hospitals in Luxor and Sharm, and they are impressed and they don't believe that changes has been happened, and I've been supported so much, and I've been really proud. I've been really proud. So يعني first time to hear that, and it's already a very big step. If we're talking from the part of the EHA hospitals, so it's a very big step, in my opinion. Answer to your question, in my opinion, the most important in health tourism sector to understand our product. Then from the product, we're gonna understand what is our challenges. Then we could go in investing or not. So the most important, we're gonna go to action plan. So if we will not study our product very well, if we will not understand our product very well, and we don't understand what challenges facing our product, we will never come to the proper action plan. Our product, when I say product, we consider it's a project. Health tourism, it's a project. So it's health and tourism. It's not only health. So we are talking about 2 big products. And the health, it's not only medical. It's a medical and wellness and restore. And tourism, there is many steps to get a tourism in Egypt. So we have already millions of tourism coming to Egypt. We want to extract more millions, and want to extract a big part of them to be treated in Egypt. We are not an easy market, like a market all over around. If we see in UAE, we are a big market, Jordan, Turkey. So we are not in an easy market to compete. That's why if we didn't study very well our product, we will never understand the challenges. Second part, we have to understand also who's our target audience. Of course, it's your part, Asma, because you are into marketing.
Marketing, yeah.
Exactly.
You're talking to the marketing terminology, yes.
Exactly. So I'm talking about target audience because I touched base with the different target audience. Our target audience is B2B, B2C, B2G even. We do not marketing for, or we do not target by person. We have to target all the sectors of target audience. So investing, when you're talking about investing in health tourism, my part is to invest not in facilities, my part to invest how to get my target audience, how to solve the challenges. Okay?
Okay. طيب, Dr. Ahmed, how can LGA Group support the development of healthcare infrastructure, critical infrastructure to Egypt's success in health tourism? دور بقى LGA حضرتك.
Okay, LGA already we had very long meeting with Dr. Ahmed, Dr. Amir. We are putting a very huge plan. It's not for the EHA hospitals, it's for medical tourism itself. First of all, LGA, we had in 11 years of experience. We have offices in Dubai, Turkey, Qatar, Saudi Arabia, Jordan. Egypt now, I see a very huge chance, very big opportunity. But as I said, we studied the product again. We have all of us who are talking about accreditation but my most important point that we have to work on it together, it is to get the trust back again for Egypt and Egyptian doctors. Believe me, I've been around all over Africa, even in Uganda, in Kampala, a lot of them, they didn't hear about Egypt in medical. Can you imagine, like, when I want to ask, why you go to South Africa, to Turkey, why you don't go to Egypt? It's easy. We never heard that Egypt can do medical. I was really surprised all over. I've been in roadshow all over Africa. I've been surprised. So first of all, we have to repair the reputation of Egypt and the Egyptian doctor. Number two, we have, I'm sorry Asma, but I'm just like, I want to express all the
No,
material.
it's all about marketing and media, I think so.
Yeah.
So
No, I mean, what we need to show transparency.
yes.
The transparency is very important. So my issue was about also digitalization and innovation, how to use it to close this gap between the service provider, مقدم الخدمة, and the clients, مستقبل الخدمة. There is a lot of people inside.
There is a
And
gap.
between them, there is a lot of people who can spoil every plan. Just believe me. So we have to put all of them in one visual platform, restricted, audited, to give full image about the full product. It's not about just to receive a patient or someone with a commission catching one patient, get it to hospital. The project's much more bigger than that. So if we succeed, and this is the first cooperation between us and Dr. Ahmed DHA, that we start to build a huge platform. Believe me, it will be one of the best platform, because I studied for 5 years all platforms all over the market. So we know the strengths and the problems in every platform all over the market. Okay?
So Dr. Ahmed, you will offer this platform.
We already under studying together. It's called healthtour.com. And
Okay.
there is a wellness part inside, which is called welltourclub.com.
Great.
And one more important thing, that we have to focus much on doctors more than hospitals, because hospitals is one part, but that's why I don't want to announce it now, but we're going to launch it in June. It will be the first club for doctors. It's called Elite Doctor Club. And we're going to accreditate even the KPI is very strong to add the most professional doctors all over in all specialty and sub-specialty under one club. And this is what it will be shining in eghealthtour.com with the cooperation with Dr. Ahmed, inshallah, with the HA, inshallah.
Thank you, Dr. Ahmed. And now, SOS team, Mr. Richard and Mr. Spestian. Mr. Spestian, the General Manager of Middle East in SOS. The presentation.
Ladies and gentlemen, Your Excellencies, Assalamu alaikum wa rahmatullah. My name is Sébastien Bédu. I'm the General Manager for Middle East at International SOS, and together with my colleague Richard, Chief Operating Officer of our Air Rescue Business Unit, we are truly honored to represent International SOS here and to reminisce the good times we had when we signed the MOU last year in our Dubai office. Let me thank again Egypt Healthcare Authority and Dr. Ahmed for the kind invitation today to this esteemed international conference that we take pride in taking part of. So International SOS is the leader in health and security, travel risk mitigation solutions. As many of you probably know, we operate in over 1,200 locations and have offices in over 90 countries. But let me start by saying that we are truly Egyptians. We've been operating in Egypt with boots on the ground in Cairo since 2011. And we employ healthcare professionals and we support local clients, international players, government bodies, NGO on a day-to-day. And it's something that we are honored in doing. How do we structure? So 53 clinics of our own, 26 assistance centers, really the backbone of our operation that employ over 10,000 health and security professionals, more than 3,000 medical and security evacuation that we've performed, that Richard will expand on the topic a little later, and almost 1 million medical services rendered over the last 40 years of operation. What are our services? So first and foremost, what comes to mind when we discuss about international SOS is, emergency, not just emergency. Assistance services. Indeed, 26 assistance services scattered all around the globe, manned by reputed health and medical and logistical and security professionals to support the international travelers, the business travelers, the domestic workforce of our clients, even individuals. This operation is, of course, like it says on the title, rendered in terms of assistance in the event something happens en route, but it's also an important element that we often ignore is about prevention and taking the phone to help our clients, the workforce of our clients, to ensure that they are fully prepared before they travel for whatever reason is key to our duty of care. Workforce resilience is actually meant at helping our clients scaling up their operation, and we can be operating in very adverse environment in the countries where the level of medical care is not up to the standards of some other cities. We'll discuss a little later about health consulting, because we trust that the health consulting piece is an element where a lot can be achieved and that a lot can be done to support health tourism and global health as a whole. But before I go, let me just mention that medical evacuation is at the heart of what we're doing, indeed, when things go wrong, and it's important for me to introduce Richard, who will be speaking about it.
Thanks, Sebastian. Good afternoon, everyone. I echo what Sebastian meant earlier in terms of being very grateful for the opportunity to be here. It's been inspiring to hear the panelists earlier talk about the plans and the objectives that Egypt has got for medical tourism. And as part of International SOS, I was asked here to represent Air Rescue to give a bit more insight into what we do in terms of aeromedical transport. So our aeromedical transport services encompasses various stages, mostly led or mainly led by the acuity of the patients that we transfer. As you would imagine, the most serious patients need to be transferred by air ambulance. Speed is of necessity, and we need to ensure that we've got the aircraft equipped to the level that we require for patient transport. So to that end, Air Rescue is the in-house air ambulance operator for International SOS. We set ourselves up in locations where we've got a high volume of client base, in locations where potentially there isn't enough medical facilities to take care of our patients around them. And then also where some of our main corporate head offices are, because we need to demonstrate these services to our clients. So to that end, we have operations set up in Johannesburg, South Africa, Dubai in the UAE, Singapore, and Port Moresby in Papua New Guinea. And these platforms are essentially dedicated private jets that have been converted to air ambulances by way of installing stretcher systems into them. We staff them with expert-level emergency physicians and ICU nurses, sometimes ALS paramedics, and they're available 24/7 to answer the call of our clients when there are emergency evacuations going on. We mentioned this today as part of this conference to obviously, plant the seed that as part of the objectives to stimulate medical tourism, we would suggest that also we consider the transport of patients. We understand that we're not looking to do emergency work, but it will go hand in hand with the development of this service here. And obviously, we'll be happy to support any requirements you have or any advice you would like, as we're excited as much as you all are. Further work we do is obviously related to the medical side in terms of security evacuations. These are mass casualty events that go hand in hand with natural disasters or geopolitical strife around the world. Unfortunately, we're seeing a lot more of that at the moment. Our team in these 26 assistance centers Sebastian mentioned are well trained with an expert network of providers around the world to gain access to aircraft, big or small. And we demonstrate that on a day-to-day basis. Beyond the air ambulance work, we also do a significant amount of general medical transport. These take place in commercial airliners. It can be a case of installing a commercial airline stretcher system in the aircraft, or to just escort the patients with, I think the last count was about 5,000 medical professionals we have on staff at the moment. So it's an important part of what we do, and it also is reliant on the airline routes, and obviously with the development of Egypt Air and everything else happening with domestic flying, that will be something you may want to look at. I'll generally end this with just giving an example of how these networks come into play, which we saw happen very much during the COVID-19 pandemic, where our network flew, in terms of COVID cases, about 10,000 hours combined across the world, which equaled about 210 trips around the world during that 18 to 24 month period. We mapped it out, and these were the main routes we operated. Very complicated during a period of time when it was hard to get into countries and access aircraft, and civil aviation during that time was actually really constrained. So we're very proud of that, but it demonstrated the work that the team did in advance of building up the network of credentialed providers to do so. We're probably starting to run out of time, and I want to get back to everything else Sebastian's talking about. But this is just effectively a life cycle of how we do our cases throughout the organization, be they air ambulance cases or anything related to what our clients call up, which total probably about 1 million cases a year across the centers. Obviously starts with them calling out these assistance centers, and then demonstrates how we go through mainly starting with medical recommendations. Everything in the organization is medically led through the experts we've got there to ultimately result in best level of patient care and the greatest outcomes. Thanks. I'll hand over to Sebastian again.
So as we mentioned earlier, probably the next stage of the rocket, the next frontier for us to support government bodies and our clients is really the consulting space in the Middle East and beyond. But if we stop on the areas of focus for us as your partners, and as we enter 2024, we believe that there are 4 main areas where an impact can be really created, whether it is on occupational health, mental health and well-being, emotional support that we take very seriously indeed, global health, and we'll have an example of global health initiatives on the next slide, and crisis management. Bottom line, to help with increasing productivity, building business resilience, and help with business continuity plans. The consulting practices that are being built by International SOS are also a representation of our client base. The need in the Middle East is growing, and we've just established our first ever Middle Eastern practice that can support the whole region with consultants on our payroll that can travel, analyze the need, tailor a solution, and deliver on the behalf of our clients. And one of the example, probably not the most recent one, but one of the most significant one that we've done was for a project in Tunisia that started in 2017 and that is still going on as we speak. In fact, in 2024, and I don't want to steal the thunder of my colleagues, God willing, a phase 2 will be happening and International SOS will be involved. So this project is dear to us. Back in 2017, in collaboration with the Ministry of Health and the European Union that funded this project, International SOS helped source 36 high technology medical equipment that were then distributed to over 200 locations within 13 governorates, where the level of medical care was not up to the standards of the capital city. And 7 years down the line, we're still helping the local communities, the local clinics, not only to supply the materials, because that would be just basic, but also to train the healthcare professionals and the maintenance team to ensure that this initiative has a tomorrow, that it's prosperous, and that we keep the momentum growing as the government of Tunisia is investing in the local communities. So with that said, we wanted to thank you again, Dr. Subhi, for the kind invitation, and to all of you who came back to the room for the presentations. And if you have any questions, Richard and I would be delighted to answer. Thank you very much.
Thank you, Mr. Sebastian. Thank you, Mr. Richard. And as we wrap up our discussion today, please allow me to express my gratitude to be with in this session and to the panelists and their insights, valuable insights. Thank you so much. And before we conclude today's session, I would like to invite Dr. Ahmed Subhi to offer some closing remarks and officially end our discussion. Dr. Ahmed.
So thank you so much, Dr. Asma, and nothing and no words can I use to express my gratitude and my thanks to all our esteemed colleagues in this prestigious panel, and also our esteemed attendees from all over the world. And thank you, Dr. Osman Abdeljalil, His Excellency, the Minister of Health in Libya. And I would like also to thank the eminent leaders from the private sector, Dr. Ahmed Izzeddin, CEO of Kilopatra, and also our esteemed leaders in healthcare and NGOs, Dr. Omara from Bahia and also from Mustashfa Al-Nas. Thank you so much for coming, and thank you for sharing us these moments. Actually, the ideas and the fruitful presentations and the valuable interventions from our guests, I think this moment now, we have to have serious step regarding the implementation of these recommendations, and also we have to collaborate with private sector and NGOs to move forward towards health tourism in Egypt. And I think by this experience and this knowledge, we can do it. Thank you so much again. And I never forget also to thank the man behind scene, Engineer Mohammed Sisi. أنا عارف إن أنت بتحبش تتشكر بس أنا هشكرك برضه المرة دي for organizing and connecting each other. Thank you so much, Engineer Mohammed, for your efforts. And thank you all my team from EHA and Asma and Riham, Dr. Gamal, Dr. Amir, all our colleagues. Thank you so much.
If you allow me, Dr. Ahmed, can we thank you, and we are all gratitude because of your support, your empowering, and all of us are here today, all the team of Egypt Healthcare Authority, because the empowerment you are giving us. Thank you so much.
Thank you. So I think it's time for Grow Food.